Hello, I'm Mackenzie, and today I'm going to be doing my IV skill video. The first thing I'm going to do is go ahead and cover my general principles and safety practices and my 11 rights to medication administration. Once I've done that, then I can go ahead and explain the procedure to my patient, perform hand hygiene, and apply gloves. Okay, once I've applied my gloves, I can go ahead and I've already drawn my medicine up. We're doing 2 milliliters of Zofran. And then I'm gonna go ahead and clean the area, and I'll clean it for 30 seconds. Well, actually, no, take that back. I'm gonna go ahead and put on my tourniquet. And then I'm gonna select the appropriate vein for my patient. Once I've done that, I will go ahead and clean the area for 30 seconds. And then I would let it dry. And then I can go ahead and insert my IV. I would dispose of this in the biohazard bin, but I'm gonna go ahead and recap in this video. Then I would not touch the site, but I would get my Tegaderm and put that on. Okay, once I'm done with that, I can go ahead and apply my J-loop. And I'm gonna clean the end of that with an alcohol pad. And make sure it's clamped. Maybe. And then I would tape that down. And I'll just make sure my patient's okay. And then I'm going to go ahead and flush it just to make sure everything goes through. And I would clean the end of it again. Make sure there's a flash of blood to know I'm in the vein. I would just do that kind of slow. Then once I've flushed it, then I can go ahead and get my IV bag and everything set up. So the first thing I want to do is go ahead and grab my primary bag here. And I'm going to spike it, got to uncap. This is sterile, and so is this tip, so we don't want that to touch anywhere else but each other. Twist it. Oh, hang on. Sorry, I grabbed the wrong one. Would not do that. This is the one I'm going to use. Spike. Make sure it doesn't touch the ground. I'm going to hang it here. And I'm going to prime my, make sure it's clamped. It is clamped. And I'm going to prime my tube. Fill it about halfway full. And then I let the air out of the lines. So I'm going to unclamp here. And it's good to go. So then I can go ahead and hook it up to my patient. I'm going to clean the end of it. Clean the end here. I can go ahead. Oops. Oh, maybe. Just make sure my patient's okay. Then I'm gonna go ahead and unclamp it and just roll it down here. Get it going. Once that's done, I can go ahead and give my patient the medication. And I'm gonna do that to the closest to my patient. I'm gonna uncap, clean the port. And I'm gonna do this slowly. Just talk to my patient, make sure they're okay. Okay, once I've done that, I can dispose of that in the biohazard bag. Then I'm gonna go ahead and grab my piggyback. We're gonna hang that up highest. Well, actually I lied because I have to spike it first. So I'm gonna uncap. Remember to keep this sterile, don't let it touch anything else along with the spike. Then I'm gonna spike. Hang it highest. Unclamp, unclamp it too fast, okay? Roll it back, and then I'm gonna hook it up. Hook it up right here. Then I can unclamp. I would make sure that my patient gets assessed 30 minutes to an hour to make sure everything's okay and running smooth. And I would just make sure that they're okay. Forgot to take the tourniquet off. I would have taken my tourniquet off after all that. Then I would take off my gloves, perform hand hygiene, and report and record.